أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. The chairman of this blessed occasion, our medical elder, Dr. Abubakar Saidu, the national president of our dear association, the Islamic Medical Association of Nigeria, in person of Professor Ibrahim Oregba, the keynote address speaker, our August visitor, in person of Dr. Mohammed Sadiq. Mr. Chairman, it seems like I have to call almost everybody. Permit me to align with the already established protocol. First of all, I would like to apologize that some people, maybe they have seen that we are coming late. Actually, it wasn't the same story. We came earlier because we were given 10 o'clock. So when we came, we have other things to address, but we have realized that there's so much to be done before the time. So please accept our apology that we are coming with the medical director of NOFIC, the National Obstetric Fistula Care Center, Ningi, in person of Dr. Halima Mukaddes, is what we have. So, first of all, I would like to sincerely appreciate the IMAN for selecting GOMBE the Jewel in the Savannah to host this great occasion. We are very much honored that the entire country is here in the Jewel in the Savannah. And we have exchanged a lot of experience, a lot of knowledge. In fact, we have exchanged so much that we believe that will go a long way in actually emphasizing our footings as members of IMAN. So we really thank the leadership of Professor Ibrahim Oregba for that. Secondly, also would like to appreciate the leadership for carefully and also deliberately selecting the theme and the sub-theme of this AGM, because if you look at it, it is talking about our own lives, what will actually lead us to Jannah, because that is the ultimate and that is what we are all praying for, and that is why we are living at this time. So you can see that humanizing today's healthcare. Everybody, I think I don't need to emphasize more that the healthcare, quite all right, is sick, and Dr. Mohammed Sadiq have done a lot, have actually talked a lot. Even the little that I could add, I think what is remaining now is to see how we can translate what he has said into our practice, because it shouldn't stop at this point. Dr. Sadiq have quoted indices, but I think even such indices are just for the Western world, where things are being done properly with clear supervision and so on. He has mentioned issues regarding the healthcare. One that he mentioned very cardinal is the access. We may not do much about the access, but what about the professional care that he has mentioned? So now, are we ready now? Are we going to swear now from this that when we go back to our various institutions, that we are going to be vanguards of making a difference? Because I don't need to mention whether as a doctor, as a nurse, as a medical laboratory scientist, and so on, there is no doubt that the community have no trust in us. And that is what he mentioned about the patient-centered journey. That trust is very important. So how can we now to rebuild our trust? To make the healthcare system in Nigeria, in terms of the professional care, nobody is going to do it for us. But anytime when we start talking, everybody will be talking about government. But what are we doing at our own levels? Most of us are kings and queens in our own small units. Is it how it's supposed to be? You are the professional knowledge. Are you putting it in place? Are you helping the institutions with your knowledge in order to make the system better? Whether as a doctor, whether as a nurse? Do you give a proper leadership? Let's start from ourselves before we talk to others. So you're coming from Kebbi, Sokoto, Ilorin, and everything. Ask yourself, are you really an exemplary leader in the healthcare delivery that we are all wish to have? Are you among the people that will be making calls while patients are talking to you? Or you will be browsing, looking at Facebook, looking at WhatsApp while you are on duty? As a nurse, do you have SOP for all what you are doing on the ward? Even as simple as using the sphygmomanometer. What do you do as a laboratory scientist when you come to work? Do you really do the work, or you assign the genius without supervision and just go? How do you manage your ward as a manager? Do you report to the management? Do you write reports? Do you follow up to check even what you are using as a tool? What efforts are you making to make the tools available? A lot of things we should ask ourselves. Are you the type of person that when patients are talking to you, you feel like they are adding more burden to you? Or you are the type that whenever patients talk to you, you will smile and welcome the patient and talk to him in a manner that he will now have care? Because as Dr. Sadiq had mentioned, there are so many things they don't need injection. He has mentioned they don't need injection. In fact, there are so many people that are coming, they will come more than 20 times. It is just that because they have not gotten a person that will talk to them. When you come, before you start talking, prescription and everything you have given. And that is not what the patient is asking for. Ask yourself, are you among the people who are killing patients on the ward? Some people will just look at it as harsh, but that is actually what is happening. If you come to the ward as a nurse, there is a suction machine, and you went and sit without checking the functionality of that suction machine. It is when the need arises, then we will go and you found out that it's not working, you have killed that patient. How many times do you validate the sphygmomanometer that you use to be sure that it is giving you the accurate result? If you are in the laboratory, how many times do you validate your system to make sure that the glucose level that you give is actually the glucose level that is supposed to be for that patient? If you are a doctor, how many times and minutes do you take to look at this patient? It may amaze you to know that personal experience, we have seen that anytime when you talk to the healthcare givers, they will tell you that the workload. When you try to reduce the workload, that is when they will start making arrangement of not to come to work. No, this one we have a practical experience. It's not about whatever. There was a time that we went as low as giving doctors particular number of patients that they desire to see. But when we did that, then they started closing the clinic by 11 a.m. So how many minutes do you have per patient that you started seeing patients from 8 a.m. and you close by 11:30? Saying that I have exhausted my patient. Is it not 20 patients I have seen? there's no trust. So please, he has given us everything in block, but just be mindful that Allah subhanahu wa ta'ala is going to ask you. All the level of leadership in the healthcare, there is no proper supervision, no proper assessment, nothing. Everything was just left to the chief executive. People will just be talking about the chief executive. The chief executive is the ultimate in that institution. Whatever that will come to him, then everything she will be seeing that everything has been put in place. So let us, all of us, go back and think. Always think. You are coming to work, your children will tell you that, Baba, okay, you have gone and spent 6 hours, 7 hours. What have you contributed to the system? Or it is just after the end of the month, you will be worrying everybody that alert is yet to drop. Okay? So please, let's sanitize what we are earning. If not, at the end of the day, you will find out that what you are earning is haram. And you know what that means. Let's try as much as we could to translate what Dr. Mohammed Sadiq have actually said, especially about, because we are the only people that can change the system. People will not come from heaven. And the IMAN have started their journey. Please, let's all of us join the train. It's not going to be an easy ride, but we believe one day it is going to be something to celebrate. Let us all be safe in wherever we are. If in your institution of care that your wife or your relatives are ill, that you have to come in order to assist them for the care, that institutions need to be reviewed. That means you are not safe. Let's build a very safer and reliable healthcare delivery in Nigeria. Let's humanize our own institutions to be institutions with human face, so that the trust and the patient-centered journey could be straightforward for everybody. And I'm telling you, a lot of miraculous things will come to the healthcare delivery in this country. May Allah continue to guide us and make our journey much easier. Assalamu alaikum.